My name's Clifford Houseman, and I'm a neurosurgeon here that works in the Detroit, Michigan area. And I perform predominantly spinal procedures, though I do also still do brain surgery. We're here today discussing the SI fusion procedure and my experience with it and some of the relief I've seen it give to patients who have some chronic low back pain. The SI joint, or which is commonly referred to, or the sacroiliac joint, is a joint that helps connect the pelvis to the lower part of the spine, or the sacrum to the iliac bone. And it's a joint that has minimal motion but can lead to quite a bit of pain if it becomes irritated or has issues with the ligaments holding it together.
The SI joint pain caused me not to be able to do really and truly no housework. I couldn't vacuum. I even, to rinse off dishes just standing at the sink, I couldn't put weight on that side of my body, and it really, I couldn't, socially even, I couldn't go too far other than get into the car and drive and then be in pain the whole time I was driving, or even sitting at home. I felt like really an old lady not being able to do anything.
So if patients are at home wondering if their back pain could be caused by the SI joint, and one easy test to start with is what's called the positive Fortin finger test. And that's basically where you can place your fingers on your back, typically off to one side, in an area where there's a specific amount of pain that's tender to touch, and that seems to be the main area where your pain is. Frequently patients come in saying that they've had back pain. Typically it's been going on for quite some time. They've been worked up by potentially other providers with MRIs that don't look too impressive. The pain's typically off to one side, lower back area, and sometimes it gets confused with sciatica, as most patients will say, where the pain goes down the back of the leg or side of the leg to the knee. Occasionally it can be associated with tingling, numbness, weakness, a feeling of the leg giving out, and it can be difficult to sit or stand or put pressure on that side of the body. The surgery itself is a minimally invasive procedure, typically done through a 2 to 3 centimeter incision that's sort of located over the right or left side, depending on the pain buttock area. Through that small skin incision, we implant pins down into the iliac bone, which we then, utilizing X-ray, push across the SI joint. And then this allows us to create a space then to create a hole in the bone, which we then put implants down, which would go through the iliac bone into the sacrum, stabilizing the SI joint. I use SI bone implants because they are, to me, they are a triangular shape that helps prevent rotation or the motion at the joint and helps it stabilize. These are titanium coated implants. The new implant that I use is called a 3D iFuse implant, which has greater cavity in the center of it for me to place some cadaver bone or bone cells, which can help with bone growth across the SI joint. And I feel that gives me the best chance to stabilize the spine of the SI joint, as well as allow for there to be bone growth across the SI joint.
I've had back problems since I can remember. Probably about 25 years old, I started with back pain, always on the one side. I have not had back pain since I've had the surgery in February.
Well, you've done very, very well from the surgery. The biggest question I always ask patients when they get to be 9 months to a year out from surgery is, did it help and would you do it again?
Definitely.
iFuse gave me my life back. My experience with Dr. Houseman at Michigan Spine and Brain Surgeons has been tremendous. I would recommend Dr. Houseman to everybody.
So if you're a patient who's dealing with what we've been discussing today, you can contact our Southfield office, Michigan Spine and Brain Surgeons, and they will get you an appointment set up at an appropriate office near you to be evaluated.